Aloha. Aloha. I'm Scott Makuakane of the Senior Counsel Division, and I welcome you to the October 6th Coffee Hour, where we are blessed to have a very special guest speaker, Taryn Kumamoto, who is a licensed independent agent who helps people find Medicare insurance providers. Before becoming a Medicare insurance agent, Taryn was a financial advisor with various companies for 8 years. She holds a Bachelor of Business Administration from the University of Hawaii at Manoa and her MBA in Business Administration from Chaminade University. And hold on to your hats, be ready for a whole lot of excellent information. Thank you very much for being here, Taryn, and take it away.
Thank you, Scott. Thank you, everyone, for attending today. It's nice to be back. I think I was here last year, too. A little bit about myself, just so you know, who the heck is this girl? And actually, a lot of you may have seen my presentation before, and you're back. Some of you have not seen it, so I'm going to give you a lot of information to take away today. But a little bit about myself, as Scott mentioned, I've been in the Medicare industry since 2008. Before that, I was a financial advisor. So I do tell the financial advisor folks that I work with, I'm no longer licensed with financial products, so there's no competition there. But since 2008, I'm only doing Medicare. So I'm only focused on Medicare. And then the various contracts I have include HMSA, AARP United Healthcare, Humana, Devoted, and then recently I received my contracting with Kaiser. So our company is called PBC Premier Benefit Consultants, and we are a Medicare brokerage agency. So we represent now, we actually represent all the Medicare carriers in Hawaii. So I'm not licensed with all of them. There are a few more, but these are the ones that I chose to get licensed with. And for all of you folks listening here, I do not charge a consultation fee. Yay! But you're asking, okay, Taryn, so how do you get paid, right? So Medicare, which is CMS, Center for Medicare and Medicaid Services, says because we know so much about Medicare, we cannot charge a fee. So we cannot charge a fee to our clients. I tell them there's no cost, there's no obligation, but I do humbly ask, and I just say, if the information I provided you, you feel there's value, there's service, and you would like me to become your agent, then please come back to me and let me write your enrollment for that plan so I can be your agent. And then the insurance company compensates me in the form of a commission. So that's how we are compensated. No, you can't buy me lunch or take me out to dinner as well. You can't do that. Okay. So anyway, thank you folks for asking, how are we paid? I went to the University of Hawaii, so I'll try to keep this fun as well, just because I was a cheerleader. Go Bows. So I cheered for the University of Hawaii and also for Kailua High School. That's where I graduated. So go Surf Riders. And Ohana Life and Fun Fact. So I am married. I have 2 beautiful kids, age 7 and 9, although, it's a tough age right now. And I'm very busy with their school activities, but it's very joyous and they bring me a lot of love. And I also have 3 dogs. So not only do I have the 2 kids and the 3 dogs, volunteering for school and running my Medicare practice, I'm quite busy, and so are you folks. So let's get on to the agenda. And feel free, this is really, informal and we can chat. So maybe Desmond might answer or have some questions and he can bring it up in the chat feature. So with the agenda, we're going to talk about the rising cost of healthcare, Medicare Basics. So what is Medicare? When are you eligible? When can you enroll? What are these alphabets, A, B, C, and D? And then how to complete your coverage, which includes supplement plans and advantage plans and how to choose them. Real briefly, so the costs of Medicare, so the healthcare spending in the United States is $4.1 trillion a year based on a 2020 study. So basically that's $12,530 per person, which CMS Center for Medicare and Medicaid Services projects by 2028, the costs will climb to 6.2 trillion a year, an average annual rate growth of 5.4%. And the three key factors driving the US healthcare costs: prescription drugs, hospital spending, physician and clinical services expenditures. And I found all this information on cms.gov, Blue Cross Blue Shield, and the Peter G. Peterson Foundation. So let's talk about Medicare Basics. What is Medicare? Just remember, Medicare is a federal health insurance program. So the federal government funds Medicare through the payroll tax contributions and the general tax revenues known as FICA. So if you look at your pay stub and it says FICA, FICA, and there's a percentage or a dollar amount, right? It's a dollar amount coming out. That's going to pay for your Medicare premiums. So Part A, we call premium free. So in order to qualify for Medicare, here we go. You are a US citizen or a legal resident who has lived in the United States for at least 5 consecutive years, including the 5 years just before applying for Medicare. And you or your spouse worked 10 years, so you have 40 credits, in the United States and are age 65 of age. Or people under 65 that collect disability benefits from Social Security for 24 months. Or anyone with ALS, which is Lou Gehrig's disease, or kidney failure. So for example, most of my clients are 65 and over, and they qualify for Medicare. But I do have some clients that are 20 years old, 30 years old, 40 years old, due to a disability or kidney failure. And so therefore they qualify for Medicare Parts A and B. So enrolling into Medicare, this is a really good screenshot here. The initial enrollment period for many of you, if you're turning 65 soon, please remember it's called IEP, initial enrollment period. You have a 7-month window. What does that mean? 3 months before your birth month, then your birth month, and then 3 months after is when you can enroll into Medicare. Now, to determine if you want Medicare A only or just A and B, depends on if you still have employer medical coverage, meaning you're working when you're 65. So the IEP, if you want to write this down, if you're still working and you have medical coverage through yourself or your spouse, then you could possibly defer Part B, Medicare Part B. And therefore you just pick up Medicare Part A, which is hospital. Even though you're going to apply 3 months before your birth month, it will not start until the first day of your birth month. So if this month is October and we're getting ready for a January 1 birth month, so you can enroll in October or November or December, but it will not be effective until January 1st, if that's your birth month, okay? If you enroll after your birth month, so let's say your birth month was January, and you were enrolled in February or March, it will not retro to January 1st. Your effective date will now be 2 to 3 months after that time, which is okay. So that's why they say it's a 7-month window. The next column, special enrollment period. So there's penalties. There could be penalties, but you want to avoid them. Anytime you're still covered by a group health plan and are Medicare eligible, you can enroll into Medicare Parts A and B without penalty. During the 8-month period that begins the month after your employment or coverage ends, whichever happens first, you can enroll into Medicare Part B without penalty. Okay, but write this down. You need to pick up a Medicare drug plan, Medicare Part D, within 63 days of losing employer coverage plan. So these are the little things that a lot of people are not going to know until they talk to someone like me that knows the very details. So again, even though you lose employer coverage, right, I want to help you transition right after. So normally we're going to pick up Medicare Part B, right, for the next month, as well as a D, Medicare drug plan. And as we'll go further into this conversation, we'll just pick up possibly a Medicare Part C plan, Medicare Advantage, which includes hospital, A, B, and D drugs. And then the last column, general enrollment period. This is between January 1st and March 31st with coverage starting July 1st. but you may be susceptible to late enrollment penalties. For example, my client calls me, and I think it probably was after July, it was August or September, and he does not have Medicare B. He had A, he didn't have B. He actually has no medical insurance right now. So the problem with this is that he needs to wait between January 1st and March 31st to put on that Part B, but that Part B is not going to be effective until July 1st. So as you can see, there's some windows that you need to be aware of, and then possible penalties. Okay, original Medicare. So Part A, it's 0 premium a month. So this is where you are paying from your paycheck, right? The FICA. Therefore, your Part A is 0 premium, and it covers inpatient hospitalization, skilled nursing, home health care, and hospice. There's an annual deductible of $1,500, and this is based on 2022 information. Days 61 to 90. So I tell people it's premium free, but it's not benefit free. And they're like, oh, what do you mean by that, Taryn? In other words, even though there's no premium, you still have to pay these deductibles and co-insurance. As you can see on the screen, day 61 to 90, you pay $389 per day. Then days 91 and beyond, you pay $778 co-insurance per each lifetime reserve days after the 90-day benefit period. And there's 60 lifetime reserve days. So in other words, when you're in the hospital, you can pay a lot of money out of pocket if you don't have other coverage. Here's Part B, we call medical. And the premium is $170.10 a month. I just got the 2023 rates, which you can Google that too. It's $164.90 per month. So it actually came down a few dollars. And the 2022, so this annual deductible for Part B this year is $233. For next year, it's, oh, look at that. I was supposed to put $223, I'm sorry. So next year it's $223 for 2023. And it covers doctor services, durable medical equipment, other medical and preventive services. Typically, you pay 20% and the government covers 80%. So again, there's an annual deductible for Part B, and then it's an 80-20 coinsurance. So the government picks up 80%, you would pay 20%, but 20% of what, right? That's the unknown. And then the last bullet, higher incomes may pay more for Parts B and D premiums. So thank you to Martin. In the next slide, I'm going to show you those IRMA amounts. Okay, what's not covered though? So please remember, under original Medicare, routine eye exam is not covered, eyewear, dental, hearing exam and hearing aids, cosmetic surgery, long-term care unless you qualify by means of obtaining Medicaid, and Part D, Medicare prescription drugs, is not covered under Medicare A and B. What's IRMA? What the heck is IRMA? Okay, so for those of you, if this is brand new, you have not heard IRMA before, it's called Income Related Adjustment Amount. It's a surcharge added to the monthly Medicare Part B and D premium based on yearly income, or your MAGI, Modified Adjusted Gross Income. Social Security uses the income tax information from your 2 years prior tax return to determine if a surcharge is owed in addition to the Part B monthly premium and the Part D monthly premium. Again, the surcharge amount depends on your income tax bracket. What is Taryn talking about? So here we go. This is the sheet, and you can Google again, Medicare and IRMA, and this will be shown to you. So Medicare cost 2022, right? But remember, you're going to look at your 2 years prior tax return. The first column is for someone that files as an individual, and you're looking at your 2020 tax return. The second column is married filing joint. The third column is married filing separate. I'm sorry, you know, I just edited these sheets, so I'll update this. So it's married filing separate, but it is the correct figures there. Part B premium, there's the base premium, $170.10, which we talked about. And then the far right is the Part D IRMA. So I'll let you folks kind of look at this screen for a little bit. And you would find your, based on your tax return, your modified adjusted gross income, which is your adjusted gross income plus tax exempt interest. I am not a CPA. Again, I'm not a financial advisor. So, please talk to your professionals about that. But with your Maggie, look at this columns, your rows, and see where you fall. Okay, so if you are in the highest tax bracket, which basically on this chart, you're married filing joint and you made over 750,000, move to the right and it says $578.30 a month per person. Please remember, Medicare is an individual plan. It's not a family plan. Sorry about that. And to the far right, there's the D IRMA or drug IRMA. So in addition to the Part D plan, there could be a cost to that. So let's say your Medicare Part D drug plan is $30. You would have to add that $77.90 to that plan. But basically the $77.90 is your IRMA, the income related adjustment amount. Okay. Any questions on this? Because I know it could be confusing. Feel free to just unmute because I'm happy to talk more about this chart. Also, if you want to try and do some planning, I guess you could figure out, okay, do I need to do, I talked to their financial advisors. So if you're doing Roth conversions, right, be aware that if you do a Roth conversion, it's going to increase your income, which is going to increase your monthly premiums. And so you're going to get hit with the B and D IRMAs. If you're going to sell a investment property, that income, it's going to increase your premiums again. So you could somehow, if you want to defer some monies or talk to your financial advisor, but please let them know that there are these IRMAs, the income related monthly adjustment amount. The good news is that write this down, because I don't have it in the slide. Write this form down, SSA 44, life-changing event. Again, SSA, which stands for Social Security Administration, SSA-44 life-changing event form. There's 8 categories, and if you check off one of those 8, you fill out this form, you sign it, you have to attach documentation to prove you had a life-changing event. But for example, some of my clients might choose work reduction or work stoppage. And so if we choose work stoppage, let's say you retired, you choose work stoppage, that's one of 8 life-changing events. You may put your last 2 pay stubs in there. And then also you have to wait till you get the letter from Medicare that says, oh, dear so-and-so, we see that your 2 years prior tax return is X, Y, and Z. Therefore, you will be having an IRMA, income related monthly adjustment amount. When you get that letter, that's when you can fill out that SSA 44. And right now I'm helping my clients. We fax that in to the local Social Security office. They take about 1 month to review it, and then they'll get back to you. Normally they'll send you a letter in the mail and telling you, yes, we received your SSA 44 life-changing event. And yes, we will reduce the IRMA. Reducing the IRMA, I don't know how much they reduce it by. I'm not sure if they go down by 1 tier or 2 tiers. My clients just call me back and say, hey, Taryn, great news. The SSA 44 worked, and instead of paying X amount, now we pay Y amount, and it's lower, right? But again, I can't tell you if they got the reduction all the way to the base amount or 1 or 2 lower amounts. Everyone's varied for some reason. I'm not sure. Again, that's a form with Social Security. Okay. So I think we got IRMA done. There's a lot to talk about there. So completing your coverage, now the next step. So let's assume you have Medicare A and B, and you're saying, okay, what should I go with? A supplement plan or a Medicare Advantage plan? So these are your options. Are we going to choose a supplement with a Part D plan or a Medicare Advantage plan called Part C? They're all offered through private insurance companies. Please remember, you cannot have both a supplement and an advantage plan. It's either or. Okay, the government says it's either or. You can't have them all, even if you would like them. This is what it looks like, for example, kind of to keep things clear. So you have your Medicare card, your red, white, and blue card. And by the way, if you come across your friends or your Ohana and you see their card and it has your social security number on there, that's an old card. So they need to contact Social Security, whether it's by phone or create an account, ssa.gov, and tell them to send you a replacement card. Because as you can see here, there's alphabets and numbers for your Medicare number. So again, if you have your Social Security number on that Medicare card, that is old. That kind of went away maybe about 4 or 5 years ago. And so it should have alphabets and numbers. You would choose a Medicare supplement plan to your left and a drug plan. So it's a la carte. So you would show 3 cards. You would show Medicare A and B card, your supplement card, and your drug card. Or you choose a Medicare Advantage plan. When you choose a Medicare Advantage plan, your red, white, and blue card benefits is integrated into your Part C plan. So even though you have 2 cards, you do not show 2 cards. You will just show your Part C Advantage plan card. Okay, so again, let me repeat. If you choose the Advantage plan route, you do have 2 cards, but you do not have dual coverage. No dual coverage. You only have the Part C plan. Whereas on the left-hand side, you have original Medicare, which is your primary payer of services, your supplement plan, which is a secondary payer, and then you have your drug plan. For those of you, I should have asked in the beginning, but for those of you who have a retiree plan with the state, federal, city, county, and whatnot, more than likely you will not be picking up any of these plans, a Part C plan or a supplement plan. I should note that federal retiree plans or federal retirees, yes, you can pick up a Part C plan. It will not interfere with your Fed plan. However, for the city, the state, if you have a retiree medical plan, just from your former employer, then you would not pick up these plans because it could bump you off that plan. Okay, so again, with the federal retirees, yes, I help many federal retirees pick up this Part C plan. Okay, let's talk about the supplement policies, or also known as Medigap, which started in the 1980s. They're offered through private insurance companies. There's roughly 10 standardized plans. The premiums increase yearly. In Hawaii, it's based on age. It helps to pay for some or all of the out-of-pocket costs that come with original Medicare. It's a supplement to original Medicare A and B. So again, you would show Part A and B card, and then you'd show your supplement as a secondary payer. But remember, it doesn't include drug coverage, so you need to purchase a separate Part D plan. And there's usually no extra benefits, as you may hear some of your friends who might have the Advantage plan, they get the free gym membership or chiropractor and acupuncture, right? But not on the supplement plans. So if you're okay to not have those extra bells and whistles and you want the plain vanilla supplement plan because it covers more, it depends on, again, which plan you purchase. But if you're going to purchase, of course, the one that has a higher premium, it's going to cover more, then you would choose this Medigap portion. Okay. Part C Advantage plan. If you do not want the a la carte way and you're really healthy, you hardly go to the doctors, you actually might want to consider a Medicare Part C Advantage plan because the premiums can be as low as $0 a month. That's right, you heard me, $0 a month. Okay, so I better say, you folks are going to ask me, okay, Taryn, how can these insurance companies not charge anything, right? So it's up to them, right? So they're putting a 0 premium plan for the Part C Advantage plans. So what that means is that there's no premium to you. you always have to pay the Medicare Part B premium, okay? Everyone has to pay the Medicare Part B premium, which comes out of your Social Security check. If you're not collecting Social Security, you'll get a quarterly bill, or unless you or your friend or family have Medicaid, then you wouldn't pay for Part B. But other than that, everyone has to pay for Medicare Part B. Then the Part C plan could be zero, and that's just how they charge. To give you a better idea, and this is more information that maybe folks may not want to know about, but I'll just tell you anyway, so that you become more akamai. When you join a Medicare Part C Advantage plan, your Part B premium that you're paying, right? So let's say the $170.10, which is this year, 2022, that Part B premium that you're paying, it goes to the government, to Social Security, but then in turn, the government in turn pays that to your Medicare Part C Advantage plan. So your Medicare Part C Advantage plan, that's why you only show that one card, because they're taking care of all your benefits and services. In addition, when you join a Part C Advantage plan, Medicare pays the Part C plan, that insurance company, X dollar amount per month per person. When I started in 2008, I think it was about $600 a month per person. So I'm sure it's gone up, not sure how much, but it's gone up by then. So that's when I want to explain to you, that's why you're only showing one card, because Medicare, your Part B premium is going to the government, but in turn, they're sending that to your Part C plan, okay? So with the Advantage plans, they started in 1997 or created, but the plan sales started in 2006 and I started in 2008. So it was very new. It's offered through private insurance companies. It pays instead of original Medicare, which we just went over that. It covers all the benefits of original Medicare. So I need to explain that when you join a Part C Advantage plan, you don't lose any benefits of original Medicare. In fact, all of your benefits from Medicare are integrated inside your Advantage plan, and the Advantage plan companies have to give extra benefits too. So that's how that works. May include extra benefits like dental, vision, hearing, gym membership, emergency coverage outside the United States, and also some of them could include your Medicare Part D prescription drug coverage. Continuing on, you must continue to pay your Part B premium. I'm sorry I keep repeating this. It's just that I do these presentations a lot. And at the end of the day, people say, oh, so how much does all of this cost? And I want to remind you that you need to pay your Part B premium plus your Medicare Advantage premium. So you must have both Medicare A and B to enroll and have a valid enrollment period. Again, if you have Medicare Part A, because you're 65 and you're still employed, you cannot purchase a Part C Advantage plan because you have to have Medicare A and B. So in your case, we just hold on, we'll be patient until you lose your employer coverage plan, and then I'll help you put on the Part B, and we either choose a Part C Advantage plan or a supplement plan. And again, you would only show your Part C card. The biggest benefit is there's this thing called a built-in safety net or an annual max out of pocket. So if you recall, I told you original Medicare Part B, right? It's an 80-20 coinsurance, but you pay 20% of what? The unknown. When you join a Part C Advantage plan, they all have what's called an annual maximum out of pocket for the hospital and medical component only. So in other words, some may be $3,400, some may be $6,700, and that amount is the most you would pay if something major catastrophic happens to you for hospital or medical. So that's really good, right? Versus if you only had original Medicare, no other retiree plan, okay? But if you only had original Medicare, that's the downfall, or the biggest consideration is like, oh my gosh, how much am I gonna pay for that, right? That's why you wanna have a Part C plan or a Medigap plan. There's a catastrophic coverage amount for Part D prescription drugs. So yes, there's another amount for prescription drugs, like a cap. This year it's $7,050. So in other words, once you've paid $7,000.50 for your Medicare drug plan, which not a lot of people do, I think the percentage was maybe 15% of people actually hit that 7,000 catastrophic figure. But if you do hit that, then the government says, okay, you pay less, maybe $5, $9, or 5% of the medicine cost. It's best to use network providers. So we have something called PPOs and HMOs, which stand for Preferred Provider Organization. HMO is Health Maintenance Organization. Basically, if you like a PPO, that means you can see doctors in or out of the network. If you see someone in the network, the co-pays would be lower. If they're out of the network, the co-pays would be higher, but you can still see them. Versus a HMO, that means you have to stay within that one network. It's called a HMO, Health Maintenance Organization. And either or, it's just whichever works best for you. There's no good or bad. It's just whichever you prefer. And then you may qualify for financial assistance. So in this bullet point, you may have friends or family that say, hey, I have an Advantage plan and I pay nothing. So they may have Part A, B, right? And then they purchase the Part C, which is zero premium for some plans. But then when they're co-pays, they pay nothing, okay? So they could have both Medicare and Medicaid, right, Scott? So if they have both Medicare and Medicaid, then they can also have what's called a dual Medicare Advantage plan. It's a Part C plan designed for our friends that have both Medicare and Medicaid. So then they actually pay nothing for their co-pays for doctors and hospital and even medicine. If you enroll into Part B or D late, you may incur late enrollment penalties, and I'll share with that in the next slide. And please remember, a Medicare supplement plan is not an Advantage plan. Vice versa, you have to choose one. And this is the summary. I think everyone likes this slide because it's easy to see. Part A and B, we call original Medicare. Again, Part A is your hospital benefits. It's premium free if you're eligible. There are deductibles and co-insurance. And then Part B, we call medical, which is doctor visits, labs, x-rays, outpatient. It's $170.10 a month, which is the premium. But again, it depends on your income, which were the slides before, right? The IRMA, income related monthly adjustment amount. So if you have a higher income, they look at your 2 years prior tax return, then you may have that surcharge. And to clarify again with the IRMA, they look back at your 2 years prior tax return and it's adjusted yearly. For example, this year is 2022. So they're looking at 2020 tax return. Next year is 2023. They're looking at 2021 tax return. The following year is 2024, and then they're looking at 2022 tax return. So I hope that makes sense where they're looking back at your 2 years prior tax return, but it is adjusted annually. You do not have to do anything. Medicare talks to the IRS. Isn't that nice? Okay, Part B, medical, there are deductibles and co-insurance. That's the one where it's a $233 annual deductible for this year, 2022. And the co-insurance is the 80-20%. So you would pay the 20%, the government covers 80%. The unlimited maximum out of pocket. So the 20% of what, right? We don't know. And no Part D drug coverage. So again, there's no prescription drug coverage on Medicare A and B. The second column is your Medicare supplement or the Medigap. You would purchase this through private insurance carriers. Again, it's a supplement to Parts A and B only. It may pay some or all of your deductibles and co-insurance of Parts A and B. In Hawaii, we have 8 different plans to choose from. It makes people go nuts because the letters are the same. It's plan, not part, but plans A, B, K, I think, L, N, F, G. So anyway, I'll help you choose one of those plans. But basically, let's see, if you picked up Medicare before year 2020, before December 2020, you're grandfathered into Plan F, F as in Frank, which means you wouldn't pay any of your deductibles or co-insurance for the hospital or medical. You wouldn't have any co-pays if you picked up this Plan F. If you turned 65 from January 2021, then the most coverage plan would be Plan G for the Medigap. Okay, so we can go over that on our one-to-one conversations. The premiums are based on age, and the premiums increase roughly 5 to 8% per year. There's no extra benefits like the free gym membership. Sorry about that. I keep pushing our plans, you know, because I'm the agent and I say, hey, X, Y, and Z plan. Can you folks maybe add on a free gym membership? But, you know, the reasoning they come back is because these plans cover so much just on the Medicare A and B side that they are not putting on a free gym membership plan. So, and that's understandable because, again, my clients who choose this Medigap, they come back to me. So I think it was so cute. One of my clients, she calls me up and she says, hey, Taryn, the Medigap plan you put me on. I said, yes. She said, thank you so much for putting me on that plan, because when I went to the hospital this past year, I had hip surgery. I didn't have a bill. When I had cataract surgery or some outpatient, I didn't have a bill. So I said, oh, I'm so glad, Mrs. So-and-so, that this plan worked out well for you. And she said, but the premiums increase every year and that's okay. So I said, okay, as long as, you know, you're happy with the plan, the Medigap may work for some people, not for everyone, because again, the premiums do increase every year. And you must buy a separate drug plan. Third column, Part C Advantage plan. So it's a bundled plan. In other words, we include Medicare's A, B, and most times D, which is drugs, in that plan. The premiums vary by the carrier. So it roughly starts off at a 0 premium. There's some that's about $50 a month premium. There's some that's about $100 and maybe $175. So those are the approximate costs for the Part C plans. There is an annual maximum out of pocket. So that's great. In other words, if something major or catastrophic happens to you, let's say you chose the 0 premium advantage plan, like no cost. What my mom didn't even tell you that. My mom is my client and she has the 0 premium advantage plan. So in her case, if something major happens to her, then it's $6,700 is the most she would pay out of pocket. But, you know, over these years, she's never reached that. She did have a surgery on one shoulder, surgery on the other shoulder, but I think the most she paid was maybe $1,200 or $1,500. That's with the insurance, of course. That was her share. But the annual maximum out of pocket is really important because it gives you peace of mind, right? So if something major happens to you, then there's a cap. There's a limit. And then it may include extra benefits such as vision, chiropractor and acupuncture, and then your free gym membership. And then lastly, the late enrollment penalties, Part B, which is medical, right? So it's 10% of your Part B premium times a full 12-month period that you didn't have it. In other words, let's say your base premium is $170.10. So if you didn't have it for 1 year, it's $17.01 a month added to the $170, okay? And that premium is in perpetuity. It's for life. So you want to be sure you're aware of these premiums, not only for yourself, but your friends and your family, because I do have clients that have this penalty and it's for life. In addition, I have clients that have the Part D penalty, prescription drug penalty, and that's 1% times the number of months you didn't have a Part D plan times the average Part D premium is roughly about $33. So for example, my client came to my seminar probably when I first started, right, in 2008. He came to my seminar and he said, oh, Taryn, I want the Part C Advantage plan, but can you just put one on that doesn't include drug coverage because I'm healthy. I don't take prescription drugs. I don't need a drug plan. And I said, Mr. So-and-so, we should just put it on because down the line, you may need prescription drugs, right? And he goes, no, don't put it on. I don't want it. So of course I need to listen to my clients and we didn't put it on. So we do have Part C Advantage plans without drug component. So we put that on happily along 5 years later, he comes to my seminar again, right? And he's like, oh, Taryn, hello there. I'm like, hi. He's like, I should have listened to you. I was like, what happened? He said, now I take prescription drugs. And I said, oh, okay. I'm sorry to hear that, now you have to take some. He goes, yeah, but the part is that you told me to pick up the Part D plan. And so, I didn't listen to you on that part, but I have to pay $400 a month for my medicine costs because some of it is brands, right? So you're paying the retail cost of the brand name medicine because he doesn't have drug coverage. So I said, well, let's put on the Part D, within your Part C plan, because I'm sure it will cost less to put on the Part D plan with the penalty if you didn't have a Part D drug plan at all, right? So this is exactly, here's the case. 60 months, right, which is 5 years, he didn't have the Part D plan when he was supposed to. So it's 60 months times 1% times $33, and there you go, $19.80 a month is his penalty for life. Okay, but now he has a drug plan, so he's happy. The enrollment periods, you folks know the initial enrollment period is a 7-month window, which includes your birth month. So again, 3 months before your birth month, 3 months after, right? So this is the time where you're like, so should I enroll in just Part A, right? Or do I do A and B? So if you're not sure, contact someone like me that we can help you navigate that question. Write this down to go to ssa.gov, Social Security Administration. Again, I do not work for Social Security. I do not work for CMS, which is Center for Medicare and Medicaid Services. I am an independent agent, right? I'm self-employed. I am a broker. I represent these plans. So anyway, go to ssa.gov and create your account, because this is how you're going to apply online for your Medicare card. Okay, number 2, AEP, annual enrollment period, October 15th through December 7th. This is the crazy time when you folks call me and I say, I'm super going nuts right now, right? Because it's open enrollment, but I'm so happy to talk to each and every one of you during this time, but we may need to make sure we text each other or email just to make sure we connect, right? And get you all signed up on your plan, or at least your Medicare. But once you're on Medicare, you have A and B, let's say you chose an Advantage plan already, and now you're like, oh, okay, I've been on the plan for a year, and oh, annual enrollment period, what is this? This is the time that you can make a switch. So if you're happy with your plan, you do not do anything. You are automatically renewed. But if you're not happy with your plan, or you want to just change plans because you saw something else out there, this would be the time to do it. October 15th through December 7th. The plan will start January 1st of the following year. In addition, for those of you that have Medicare A and B and weren't able to pick up an Advantage plan or a supplement plan during that time, or maybe you just didn't know that you could pick up an Advantage plan or a supplement, and you don't have a retiree medical plan, right, except for federal. So anyway, you can pick up a plan, a new Advantage plan right now, and effective January 1st. Number 3, open enrollment period. So let's see, this is a different this open enrollment period is January 1st to March 31st, because I know the other one I talked about was something else. Okay, that's to sign up for Medicare B. This one is if you want to switch your plan again. This is what happens. You know how December 7th, right? It's the end of annual enrollment period, but I kid you not, I get phone calls on December 8th. December 8th, they say, Taryn, yeah, can you sign me up on the plan? I was like, oh, Mr. and Mrs. So-and-so, the enrollment period ended yesterday, December 7th. We have an open enrollment period from January 1st to March 31st. And if you could wait that month, from January 1st, then I can switch your plan. It'll be effective the 1st of the following month. So again, if I talk to someone in January, it'll be effective February. If I talk to them in February, it will be effective March. Okay, so this is for people, either it was, they totally forgot about AEP, or they did switch an AEP, annual enrollment period, but then they want to switch it back, something like that. So this is kind of like a a one-time deal actually, because you can only do it once. You can only have a one-time change. And then lastly, the special enrollment period, SEP we call it, varies depending on your situation. But for example, most times it's when people lose their employer group health plan. That would be a special enrollment period. So no, you don't have to wait to retire in October, November, December. Okay, that's the annual enrollment period for people who are already on a Medicare Advantage plan. But the special enrollment period could be you retired and so you're losing employer coverage, or you're moving to another state. That's a SEP. Okay, almost done here. So completing your coverage, again, to recap, you have original Medicare, you have parts A and B. So should you go on the supplement plan with the drug plan or the Part C Advantage plans? How do we choose? Basically, when we talk, or if you want to have a meeting with me or someone like me again, we're going to ask you some personal questions. You know, nothing is, it's always between us. It's the client confidential rule. So I would ask you for your doctor's names and then your list of medicines, if you could share that with me, because I need to do my homework and look at the plans. And looking at the plans, meaning I want you to keep your doctors and I want you to keep your medicines, of course. So we're going to find the right plan that includes your doctors and your medicines, okay? Because some plans may not have all your medicines on there, but some plans will. Some plans, your medicine may be 1 or 2 tiers less expensive than another plan. So that's why it does take a little while to do some research for you and help you make sure you pick a plan. Regarding the cost here, so you could write down Medicare Part C Advantage plan costs, write down anywhere from $0 to maybe $175 a month. On the supplement plan, someone who is age 65 now this year, to give you an example, it's about $140 a month. That's plan G, G as in girl, for the Medigap plan. And again, if you buy that Medigap plan, you'd show original Medicare. The most you would pay out of pocket would be the $233 annual deductible, because you have to pay that for Medigap G. But then when you go to the doctors and hospital, you would pay nothing. So it'd be no co-pays out of pocket. Yeah, 0. But that's the Medigap plan. Then you would have to buy a Medicare drug plan. So the drug plan, again, depends on the medicines you take. So again, if you could share that with me, I need to see what the tiers are. So there's 5 tiers. Tiers 1, 2 is generic. Tiers 3 and 4 are brands. Tier 5 is specialty. So the co-pays depends upon the medicines that you take. How do I choose? So how do I choose? Again, your doctors, your medicine, maybe how often you use your medical services. Do you travel to the mainland a lot? Do you like to use specialty clinics like the Mayo Clinic, the Stanford clinics? Those things all come into place. I know it's like so much information just regarding health insurance, but when it comes to Medicare, it's different. It's different from your employer-sponsored medical plan. And if I can just share the last bullets for me to give you one piece of, I don't know, advice or suggestion is that if you take a lot of medicines and brand name medicines, just know that you will be paying a lot for that, because it's not the same as your employer-sponsored drug plan. So in other words, you could be paying that $7,000 for that prescription, the catastrophic amount that you may reach that. So be known or be aware that you may have to set aside some funds for your prescription drugs. You know, you may hardly go to the doctors, right? You may just do your checkups, but along that, if your doctor says, oh, Mr. or Mrs. So-and-so, you know, you need to take these medicines to keep you healthy, then, and though if those medicines are brand name medicines, just to let you know, it can be more. And that's where I tell my clients, put aside some monies for that, for your medicine costs. Okay, helpful sites, because we're almost done here. Medicare.gov, HawaiiShip.org, Medicare Made Clear, MyBenefits.Hawaii.gov. Really great sites. I go to Medicare.gov myself a lot. For your friends and family that may need help with request, which is Medicaid, mybenefits.hawaii.gov, that would be the place to go. They could enroll or talk to somebody and get benefits for health insurance, food stamps, and that will really help them out. And if they do have Medicare and Medicaid, then we do have a plan called Dual, a Part C dual plan, where they get hospital medical drugs at no cost, right? And some extra benefits too, like the vision and the dental and chiro and acupuncture. So the tips here, and this is a really good slide. Sign up for Medicare Part A at 65, even if you still have employer medical coverage. So you can do this 3 months before your birth month. Be sure you have creditable medical and prescription drug coverage though, if you're gonna defer Part B, okay? So I still come across some employees that have a medical plan and no drug plan. It's far and few, but I still had come across some. So for them, we need to be sure that they pick up a Medicare drug plan too, even if they deferred B. Show your Part A Medicare card in addition to your employer medical card if you have hospital services. So in this regards, you have Medicare A, you have your employer medical plan, right? If you go to the hospital, show both cards because you do have dual coverage for hospital. That's all I wanted to share here. And then contact me 3 to 6 months before you lose employer medical, because I need to help you put on Part B. It's a 2-step process. We put on Part B, which takes about 1 month for Medicare to put on the B, meaning your employer has to sign a form, you have to sign a form, email that back to me. I fax that over to the local Social Security office. They take anywhere from 2 to 4 weeks to process. And while they're processing your Part B, then we're gonna, in the meantime, talk about, okay, what plan should I pick up? Should I pick up a Medigap with a Part D drug plan or the Part C Advantage plan? Okay, and that's it. Let's chat. Desmond and Scott, I just made it.
Okay, perfect. All right, if anyone has any questions, you can put them in the chat right now. Also, just for everyone's information, this presentation is being recorded. Just another reminder, and will be posted on our Senior Council Division webpage, probably on Friday or Monday, depending on depending on how fast I can upload it. But yeah, so I got our first. So the first question in the chat I see for enrollment window, your slide talked about when employment coverage ends. Does the same apply to ACA coverage?
Oh, thanks for bringing that up. See, there's so much to talk about. So ACA, the Affordable Care Act coverage, because I'm self-employed, so I did have ACA. And so how that works is when you have an ACA plan and you're turning your Medicare eligible, then you cannot stay on the ACA plan. In fact, you'll probably get a letter from your health insurance carrier that says, dear Mr. or Mrs. So-and-so or Ms. So-and-so, you have the ACA plan. Congratulations, you're Medicare eligible. You need to transition to Medicare A and B. So yes, I want to help you put on Medicare A and B and one of these plans so that we can transition you off the ACA plan onto the Medicare AB, and then either we get a C plan or the supplement and the drug plan. So we can start a few months before. So more than likely, if you're on the ACA plan and you're turning 65, right, we need to do all of that at the same time. Great question. Thank you for bringing that up. I'm sorry I forgot to talk about that.
Next question. If you have employer coverage after 65, should you enroll in a coverage at age 65?
Okay, great question. So again, if you have employer coverage at 65, if it's creditable medical and drug coverage, again, you could defer Part B, right? So you just have Medicare A. If you didn't know about that and you have A and B and you just want to keep it, that just means you have dual coverage and you're paying for B, then you can buy a Part C plan at 0 premium. So in fact, I do have clients that say, yes, I'm still working. My employer covers me, but I want dual coverage for, you know, their reason. So they have A, B, they have their employer coverage. And I say, well, why don't we just put on the Part C plan because it doesn't cost anything, and then you get extra benefit that original Medicare doesn't include. So that's another option. But again, to answer your question, if you do not have Part B, then you just stay on your employer medical plan. Thank you.
Okay, next question. If you choose a Medigap plan when turning 65 years old, can you switch to a Medicare Advantage later, vice versa?
Yes, thank you for that question. So if you have a Medigap plan, can you choose some Medicare Advantage? The Medicare Supplement plan is actually an insurance contract. In other words, there are health questions on that application, whereas the Medicare Advantage plan, there's no health questions on there. So in other words, when we decide which route to go, if you have some medical conditions that you're concerned about and you want really good coverage or full coverage, you may want to consider the Medigap plan, because when you turn 65 or you lose employer coverage, you have what's called GI, guarantee issue. So you can pick up a supplement plan without underwriting, without answering those health questions, and you're approved, right? That's called guarantee issue. You have a 6-month guarantee issue window period. So either it's when you turn 65 or when you lose employer coverage, that's when you can pick up a Medigap plan with guarantee issue. So let's say you picked up the Medigap plan and it's going well, but the premiums are going up, right? So two things, we could either downgrade to a different alphabet, right? I mentioned A, B, G, F, L, N. Anyway, so if G is the best plan, we could downgrade to N. That might work to save you some costs on the premiums. Or like you mentioned, you can get out of the Medigap plan, go on to an Advantage plan, but just know it's two different products. So now you're going from a Medicare supplement plan, which has a lot of coverage depending on which plan you chose, to an Advantage plan, which now you may see, you know, you have to pay some co-pays and co-insurance. However, there's still that annual max out of pocket, which is really good. And so to answer your question, yes, you can switch technically back and forth, but to go back to a Medigap plan, then you'd have to answer those health questions. So that's something to consider. Thank you.
Okay, next question. Can you help me understand the risk when transferring from Part C to Part A/B plan? Specifically, is there a coverage exclusion plan, exclusion period?
Okay, if I'm understanding this correctly, is there any, was it drawbacks?
Okay, specifically, is there a coverage exclusion period?
Coverage exclusion period. I think if you're saying, so what happens, and maybe you could, this nice speaker could email or call me afterward. When you join a Part C Advantage plan, you no longer have original Medicare. So your original Medicare benefits, all of it has to be in the Part C plan. But I'm just saying you're no longer on original Medicare, meaning you're no longer part of the government's program, right? So when you join a Part C plan, you're no longer on original Medicare through the government. You're on a private insurance company with the Part C plan. The Part C Advantage plans cannot take away any benefits. They have to give the exact same benefits plus more, which the benefit of the Advantage plan is they're giving that annual max out of pocket. That's the key. If you can remember one thing, the Advantage plan gives you that annual maximum out of pocket that original Medicare doesn't. In addition, that Part D prescription drug plan too, right? That most of them will include. So I'm sorry if I wasn't quite sure on that coverage exclusion, but it does have to include everything that Medicare A and B does for the Part C plans.
Taryn, if you can, you can put your email address in the chat box so that people can contact you if they have any further questions.
Chat. Okay. Okay.
Yeah. Okay.
Everyone.
Next question. If Medicare A, B, and C Advantage Plan is the only health insurance that I currently have, what are the reasons, if any, that would compel me to seriously consider also applying for private medical insurance?
Ooh. Say that again. So private, but
Okay.
maybe that's a question that needs to be called to me, because why would you have a private insurance company with Medicare A? That's where we'd have to clarify that. Because if you have private insurance through your employer, so if you have private insurance through your employer, right, most times, and it's credible medical and drug coverage included, most times you would only pick up Medicare A and just defer B, right? Is that what they were saying?
Well, if this person would like to email Taryn, she did leave her email in the chat. So maybe you can clarify with her after the presentation.
Yeah, sorry everyone. I know I really enjoy your questions. I enjoy talking about them, but sometimes I need a little bit more information so I can give a better explanation. Okay.
All right. Next question. This one is a three-parter.
Okay.
Are there resident time period related to Medicare and other plans? What if you have multiple residences that you use? Also, define the out of US area limits and any limits to Medicare and plans in the US Virgin Islands.
Oh, US outside. Okay, so in a nutshell, whenever you have Medicare A and B, you have to have a US resident, and we already know that, but okay, they're actually not my clients. When they live off, not within the United States, and they're not coming back, right? So I believe my client said that I think they decided, so these are my clients that they actually don't live here. They live in Hong Kong or wherever. So I don't even think they decided to not pay Part B. So that's something to consider. Like, if you're not even going to live here, are you going to pay the Part B, right? He's not paying the Part B. And then he came back and said, oh, what if I pay the Part B? And I said, well, if you pay the Part B, you're going to have all these late enrollment penalties. So I think in his case, he didn't. So that's something for you folks to decide. Are you actually not really going to come back to the States? How important is it to have medical Part B? Because you may be getting it in your other area, right, for cheaper or less cost, because the Part B, again, is depending upon your income, right? And then the income is with the IRMA. So that's something, if you don't live here, when you live here, regarding to the Part C Advantage plans and the Medigap plans, it's based upon your address with Social Security. So if you have a Hawaii residence or address, then you can only choose plans that are offered in Hawaii, right? So if you move to the California and I sold you a plan here, you cannot take that plan to your other state that you changed your address with Social Security. Once you change your address with Social Security, then you need to purchase a new plan in that state. So those are the rules. And regarding the coverage outside, if you choose either or, the Medigap or the Advantage plan, they do cover emergency coverage outside the United States. But most times I tell my clients, you may want to consider traveler's insurance because they may cover more. The Medicare plans, the Part C Advantage plans, and the supplements is usually only for emergency situations. And also you can note down, if you do have an emergency outside, then normally we tell you, okay, you have to pay the bill while you're there, but get the receipt or invoice in English and convert it to US dollars. That will help the insurance company process it faster so that they can reimburse you, whatever they need to do. Thank you for your questions. And again, please email me if you want to, or call me to go over in depth some of your questions.
Okay. All right. Just FYI, if you have any more further questions, please email them to Taryn. But I will read off these questions left in the chat box. Okay. Will we be able to receive a copy of the speaker slides?
Oh, sure. I'm happy to share them with you folks. Just keep it for your personal use. I'm so sorry. I'll update. There was a couple incorrect figures, so I'll update that and then send that over to you. That's fine.
Since everyone in this room has your email, they can just email you for the presentation, right?
Up to you. I mean, I can give it to you and you can send it out to everybody who signed up. I'll leave it up to you.
All right. For those, okay, so since Taryn's email is in the chat box, please inquire after the presentation to
yeah, true. Some people may be like, I don't want her slides. Why are you sending it to me?
No worries. Okay. All right. Next question. If you have not worked 10 years or 40 credits, is there any way to get Medicare, pay a higher premium?
Right. Okay. Good question. So if you do not have the 10 years or 40 credits, but if your spouse does, then you could get it through your spouse. If not, then you can purchase it. And it can be pretty expensive. So they'll still look at how many quarters you have with Social Security, and then they'll base that premium based on how many quarters you already have. But for Part A hospital, I'm trying to think. I think my clients, I don't know how many quarters she had, but she's paying about $400 a month for hospital Part A coverage. And she doesn't qualify for Medicaid, because if you qualified for Medicaid, then you don't have to pay for that. But she doesn't qualify for Medicaid. So anyway, she pays about $400 for Part A. And then of course, the Part B is based on your income. So yes, you can buy it, but it just depends on how many quarters you had to figure out your Part A premium cost. And then the B is depending upon your 2 years prior income. Yeah.
Okay, next question. Someone in the chat room is asking for your phone number.
Okay, I put it on, sorry. It's on the slide now.
Yeah. If you're comfortable putting it in the chat, you can do that. You can do so. Yeah.
You guys make this so hard for me because I'm trying to type and listen at the same time. Okay. I know some of you folks are my clients, and I know you're like, oh, Taryn, hold on now. Okay, wait, to everyone. Okay, that's my, I better put mobile. Okay, mobile. There you go.
Okay.
Yeah, no need to call the office, because if you call the office, they're just gonna say, do you have her mobile? Okay.
Yeah. Okay. Next question. At what age should one begin in earnest planning for Medicare and CU? Is 2 years prior to seeking Medicare about right?
Oh yeah. Some people call me when they're 60. Some people call me, just they want to get a really advanced idea of how these premiums work, the costs, how much these plans cost too. So anywhere from 60 on, 62, 63, if you're really concerned about the IRMAs, because you can start, trying to figure out, oh, I am definitely going to work, but maybe I won't work as much, right? Maybe you're partial, so you don't get a higher income because that's going to bump up your IRMA, right? So, and definitely I would say, 2 to 3 months would be good if we need to put on the Part B. the B planning, right? Because it does take 1 month for Social Security to process that. I have clients that call me like the month of, and it's really tight. Sometimes because Medicare has to put on the B first, and then I can put on your plan, right? Sometimes I'm not able to put on your Advantage plan or Supplement plan the exact same time. Yeah, good questions.
Okay, next question. Regarding the Medigap, if you're on a spouse's plan and not your own employer's plan, when does the 6-month guarantee period start? When the gap insurance has to take you regardless of your condition?
Okay, so if I'm understanding this correctly, if you're on your spouse's employer plan or even your own employer plan, right? When you decide that you want the Medicare B effective, because I'm assuming, right, you deferred B. So if we say, okay, we want B at the end of the year, January 1st, because we're going to lose employer plan 12/31. So January 1st is the effective date. So you're going to look at the Part B effective date. Whenever that is, because we're losing the employer plan, then you have 6 months, excuse me, 6 months guarantee issue. So you have till June to decide if you want. So let's say you have A and B, and then let's say you actually chose the Part C plan, right? We go, oh, Taryn, let's choose a 0 premium Advantage plan because I'm very healthy, and yeah, let's just do the Advantage plan. So we have until June to decide, okay, do you want the Medigap plan for some reason? You want to switch gears without underwriting. That's what I should say. That's the guarantee issue. You can go on the Advantage plan for years and then later on decide I want a Medigap, but however, you will then need to answer those medical questions. I bet you somebody's going to ask me, what are those medical questions? So those medical questions are, if you're diagnosed with end-stage renal disease, which is kidney failure, and you're on dialysis, that's an absolute no. That's a decline. You or no, you will not be able to purchase this plan if you have kidney failure. The other question is, have you been hospitalized in the last 60 days? If you have been hospitalized in the last 60 days, it says, I'm sorry, you cannot apply at this time. So what we do is, we just got to wait the 60 days. Then we can apply after that. So those are the two questions that could be no for the Medigap, but not within the first 6 months of putting on Part B or turning 65 and you need a Medigap plan.
Okay, let's see. Okay, so we're actually coming up at around 1:15, and I want to be respectful of everyone's time here today. But I'm sorry if I couldn't get to all your questions today. If you have any questions in today's presentation, please email Taryn. Her email is in the chat as well as her mobile phone number. But yeah, and with that being said, our president Gilbert Doze will now be giving the closing remarks to conclude today's coffee hour presentation.
Thank you, everyone, for participating and tuning in to our coffee hour, jam-packed with so much information. Taryn, again, thank you so much for your time, information, your care for this subject matter, which is very near and dear to all of us. We really appreciate it, and everyone, please consider Taryn's invitation to call her and ask her questions and get the information that you are asking for. And I appreciate all of you tuning in. We had a total of about 72, I believe, participants, and I hope you all had some benefit in tuning in. So our next coffee hour is November 3rd, and we'll get you more information about the topic so that you can tune in. In the meantime, I hope that you have a nice afternoon, rest of the afternoon, and ahui ho. Aloha.
Hello, mahalo everyone. Thank you so much for your time.
Yeah, thank you everyone. So this presentation will be uploaded either on Friday or Monday. Just check the Senior Council Division webpage on the HSBA website. Thank you everyone. Thank you, Taryn.
Thank you.